Good evening, everybody. So for those that don't know me, my name is Suzy Foster. I am the CEO of our EMIS Health and our EMIS Enterprise businesses, which includes, of course, Community Pharmacy, hence I'm here with you tonight. So thank you so much for joining us and taking the time to be part of our first ever dedicated EMIS Pharmacy Live event. We really hope that this will become an annual event, but we're just going to see how this one goes first. So we've got a brilliant range of a brilliant agenda and a huge range of topics over the next couple of weeks, and I really do hope you can make as many of the sessions as you can. I'm also delighted to announce the launch of our new community pharmacy user group, which is going to take place immediately after this session. So we're going to try and finish this session up around 8:25. So those of you that are interested in the pharmacy user group can go on to a separate session about that very topic. So I'm just going to talk for a few minutes about what we're doing in community pharmacy, and then I'm so delighted to hand over to our guest speaker, Leyla Hannbeck, who many of you will know from AIMp, who's going to talk about the latest policy and guidance and the future impact on your businesses. And then our very own clinical director and super pharmacist, Sima, will talk and share a little bit more about the future direction of Proscript Connect and the associated products and how we're reimagining pharmacy technology. So we're going to have a few minutes at the end to take questions. You can post your questions as we go along in the chat window, which I hope you can all see. Please don't be offended if we don't have time to share and answer your question tonight. I promise that we will answer them all individually, but to do that, we please do need you to include your name and your email address with your comment. We can't see it otherwise, so please just put your details with your comment and then we'll follow up with you separately if we need to. So the last 18 months have been a challenge for all of us, haven't they? Not just because of the pandemic, but you know, that's had a massive impact on how we work, on resources and on our priorities. And as we emerge and we start to get back to normal, I just want to say thank you to you all. Thank you to all of our customers for your support and your loyalty to us, but also for everything that you've all done to maintain and deliver crucial local health services during this time. So community pharmacy is a really important part of our EMIS group business. It equates to about 20% of group revenue, and we've got now over 5,300 customers using Proscript Connect across our groups and our independents. And I'm so grateful for that and for the ongoing commitment that you've all made to us. Thank you. I know there have been some bumps along the road in the past couple of years, and that we cannot take your custom or your loyalty for granted. You and your businesses are critically important to the success of ours. I know we need to demonstrate that with investment and with innovation. So to do that, we have significantly increased our R&D investment. We've more than doubled the number of resources, the number of people that we have working on Proscript Connect now. And we've also made some critical, really high caliber new hires to bring new ideas and fresh energy to our future product roadmap. This additional investment also means we can be confident in delivering high quality product enhancements to you and on time. I know that on time thing is really important. I know we've fallen short there, but we've listened to you and we've addressed it. This larger enhanced team is also looking at the modernisation of Proscript Connect itself. Now, I'd like to think that given our tenure, we really do know and understand pharmacy, but we just can't make assumptions about that and about where the product needs to go. We can't reimagine pharmacy without your help and your insight. So we've engaged specialist consultants to help us work with you to really understand what you need, not for now, but for the future, to secure the success of your businesses and enable you to evolve the range of services you provide to your local communities and your customers. I know we've also had some performance issues recently which have caused you problems and impacted your ability to provide those services. I really am so very sorry for that. I would just love us to get to the position where we've got a completely foolproof technology solution. Maybe in the future we will, but not that anyone's completely managed it just yet. But what we are doing is looking at all of our dependencies on third parties and all of the things in our own control and trying to mitigate risk wherever we find it, to really reduce down the likelihood of performance and service issues as much as we possibly can, because we do know, I know how important that is to you. So we also know that as the healthcare landscape changes and the role of local pharmacies evolve with the implementation of integrated care systems, you'll be providing an increasingly critical role in the efficient and flexible and effective delivery of patient services to meet those patients' evolving needs. Local pharmacies will be crucial in reducing the demand on already stretched GP and urgent care services, and in supporting and empowering us all as individuals to take more responsibility for our own health and well-being. And that's why we created the Patient Access Marketplace and our GPPCS solution for both GP practices and 111. That means our pharmacy customers have technology solutions to help them grow the services that you offer to both NHS patients and privately. And we've seen some customers really embrace these new opportunities and ways of working and reap the benefits. And we've seen an increased number of appointments and services being delivered by pharmacists as that rollout's continued. For example, since rolling out Patient Access Marketplace just 16 months ago, the Greenlight Pharmacy Group has grown the number of flu jabs they've given at their local branches, 13 branches across London, by 20%, so a really significant increase through Marketplace. And we see the future of Marketplace as central to the delivery of modern, flexible healthcare services to meet that changing customer demand. And we'll work with you to ensure that we can support and lead with whatever you need, for example, blood and other testing services. And we're also looking at wider services, such as some cosmetic procedures, where we believe our pharmacy customers can provide a really valuable service to local communities by being a trusted and safe provider of those services. But we've not lost focus on our core services either, reacting to the much anticipated changes to pick to tote and pick to prescription, which allow hubs to fulfill prescriptions. For example, we've worked with our partners, Newmark and Phoenix, to develop and launch their golden tote functionality, which is enabling them to make significant time savings for their pharmacists. And we know that creating this efficiency and enabling you to free up time is critical for your future success, as it enables you to have the capacity to deliver those value-add services, get that additional revenue, and enable you to build and maintain local customer loyalty and indeed provide that much needed community service. And so we're also seeing great success with our GPPCS solution, which is embedded in our GP EMIS web, EPR, more acronyms, honestly, sorry, but that enables GP practice staff to triage responsibly and refer patients where appropriate direct to their community pharmacy. So we're now live with this across many areas, ranging from a region-wide deployment in the northeast of England, right through to individual GP practices and PCNs. This is a new solution. We're only just starting to gain traction, but the signs are already there that this will make a difference. So to illustrate, one of our early adopter areas, Somerset CCG, there the GP practice teams have already made over 1,000 new referrals to pharmacy using our solution since their go live in June, so huge impact already. And I think what this does, it demonstrates how we are uniquely positioned to be able to support our customers, because we've got that breadth of coverage across primary care and community pharmacy. We see how the focus of the market and the strategy of the NHS is moving towards more integrated, joined up care across the local area, with all providers working collaboratively to deliver the best outcomes for patients and ensure the best use of increasingly scarce resources. The future lies in the ICSs and the delivery of truly integrated care. And because of what we do, our history, and our position as market leader in both GP systems and PMR, we're really strategically positioned well to help our customers achieve this. We also recognise we need to support our customers as they compete in the consumer digital environment with online pharmacies and the pressure that that places on nominations and retention and margin. And that's why we're so excited about our smart pharmacy solution. This enables a patient to order their medication, track its progress from dispensing through to completion, and even right through to delivery in a really easy to use application. It's live, it's being piloted in a number of test sites already. Thank you to those customers. And we've learned a lot about how to improve and streamline it before it goes into general release, which we expect to be in Q1 2022. I know there's so much anticipation and keenness across our user base to get involved with smart pharmacy, but I know you won't be disappointed. It will be worth the wait. Also, just a quick update on Pinnacle. So since we acquired Pinnacle in March 2020, we've already integrated pharma outcomes with Proscript Connect. And this allows our user to move seamlessly between Proscript and any service template used in pharma outcomes, with the transfer of patient information from the PMR system into the template without you needing to rekey all of that data. This effectively makes pharma outcomes an extension of your PMR system, with features like right back saving on saving flu vaccination records. And we're going to continue to explore how we can work together and add useful functionality as part of our future planning. And also, as the cost of IT support for CPCS will be passed to providers from the end of September, we've been looking at several ways the pharma outcome solution will support the service delivery and claim management for this service. And if you want to know more about that, please make sure you join the Pharma Outcomes Direct session this Thursday, and we'll talk more about that offering. So that brings me to the end of my short introductory session. I hope it's given you a useful summary about where EMIS we see the priorities for our pharmacy customers and our pharmacy solutions, and the direction that we need to take with Proscript Connect and our other products. I really hope also it's given you some confidence in our commitment to you and this market. We are in it for the long haul, and together I believe we can achieve great success. So on that note, I'm delighted to hand over to Leyla. Thanks, Leyla.
Thank you, Suzy. Good evening, everybody, and thank you, EMIS, for inviting me to this event. Some of you may know me, but for those of you who don't, I'm Leyla Hannbeck. I'm Chief Executive of the Association of Independent Multiple Pharmacies. So today I'm basically focusing my presentation on digital transformation in pharmacy. But as someone who, next slide, please, Sima. Sorry, I'm going to have to say that every time. As someone who is involved in representation of community pharmacy on a national level, this is something that I want to put out there right at the beginning. Some of the challenges I've been facing is very much around community pharmacy not having a level playing field. I know many of you have been reading pharmacy media and have been seeing on social media the challenges that we're currently facing in regards to workforce, and seeing a big chunk of our workforce moving into PCNs and into GP practices, which has caused quite a lot of disruption around various different areas of the country. And so there is only so much that community pharmacy can do around that. And I know from what I'm hearing from our members that they do everything they can to make sure that they provide their workforce with the best possible care that they possibly can. But unfortunately, for example, GP surgeries getting funding in terms of like recruiting pharmacists and technicians into practice hasn't made it easy for community pharmacists across the country. The other challenge Suzy mentioned about ICSs, and definitely something that is very much top on our agenda that we are discussing with NHS England. And this is something that, again, community pharmacy has been involved, and I've discussed quite a lot with LPCs around the country, and I know they've been working very hard to fly their community pharmacy flag inside the ICSs. However, we want community pharmacy to be an equal partner in the ICSs at a strategic level, at a higher level, and this is definitely something that AIM is trying to champion, and we're discussing with all partners that we possibly can. Having a level playing field on the ICSS for such a big profession such as pharmacy is absolutely essential for us to make sure that this time around we seek the best outcome for patient care and for community pharmacy. Last week, another challenge was brought to my attention, and that was around flu vaccination service. We know, and Suzy referred to, how great community pharmacy has been performing around delivering flu vaccination service last year, year on year, actually. And it is disheartening to hear that, for example, GP practices get, better funding in relation to flu vaccination per vaccination compared to community pharmacies. So the level playing field not being there is a very demotivating topic, but it's something that it's definitely high on the agenda, and we are discussing with relevant organizations around that. But this presentation is about, this topic is around technology, and if anything, the pandemic has shown us that there's a place for technology in community pharmacy more than ever. And I'm very pleased about the stories that I'm hearing from our members, how they've embraced technology during the past months and continue doing so moving forward. And our job is to make sure that we look at regulation and seeing where regulation can ease down for community pharmacy to be able to further embrace technology. So next slide, please, Sima. From our perspective, technology has to be an enabler to easing the workload in community pharmacy. And I did refer to, for example, the issues around workforce and community pharmacy having those challenges at the moment. And we need to look at how technology can support us making life easier in community pharmacy and helping to maximize revenue, but also deliver great patient care. Next slide, please. So I've provided here some examples of how our members have been using technology over the past few months. I mean, some of the things that I have mentioned in this slide have been around for some time. For example, Hub and Spoke. A lot of AIM members are very much have been involved with Hub and Spoke for a number of years and are operationally very knowledgeable around Hub and Spoke. And I'm going to be talking a little bit more about Hub and Spoke in the next slides. Open pack dispensing is another area that AIM members have been involved with, particularly since some are moving away from the MDS, which can be quite cumbersome, and embracing the original packs. We've seen our members do shared vendor evaluation and implementation plans to support them with the dispensing technology. In terms of like repeat prescription ordering, our members have been embracing patient apps. And this is an area where we're seeing quite a lot of developments coming in, and it's kind of fast paced, and we need to make sure that we get the best solution for community pharmacy. There are certain challenges at the moment that need to be sorted in terms of like systems speaking with each other, but definitely something that is developing and is high on our members' agenda. Very rapid maturing markets, including the EMIS patient app, and making sure that, again, all the systems relate to each other and speak with each other. In terms of like patient communication, we've seen SMS platforms. Our members have been, looking at telephone upgrades. Video consulting is something that some people have been embracing. On prescription delivery front, I think the prescription delivery apps are something that many people have now very easily or have adapted to and are have embraced. Collection of prescriptions. Many AIM members have been looking at how to make the journey for patients easier, particularly during pandemic and the fact that we've had social distancing and patients not being able to come to pharmacies, and having kiosks or automated collection services in place. And last but not least, remote payment solutions, something that our members have been looking into, particularly since COVID and touching money and all of that has been an issue, and around point of care diagnostics, which is again another area that many AIM members have been looking at and embracing. Next slide, please. So I said I will be coming back to the Hub and Spoke topic, and one of the reasons why I wanted to talk about Hub and Spoke is that because it is very relevant at the moment, in that Department of Health are consulting with the sector on how hub and spoke could look like going forward, and how a legislative change could come in for hub and spoke, allowing single pharmacies to be able to operate this as well, to tap into the whole hub and spoke agenda. So AIM members, as I said, have been involved in hub and spoke. Many of them have been involved in hub and spoke for many years, and they have a lot of knowledge and experience from this particular topic. So we set up a group, a hub and spoke group internally within AIM, and we've invited some of the most knowledgeable operators on hub and spoke to come in and bring their knowledge together and their familiarity with the system, and look at where the challenges are and how we could tackle those challenges. And we obviously feed back those sort of issues or learnings from hub and spoke to Department of Health as well. Next slide, please. So there are some facts associated with hub and spoke that I wanted to bring out and put out there. The first thing in relation to hub and spoke is that, well, it does reduce some of the workload, and but one thing that we need to remember as well is that robotics are expensive, and if hub and spoke is to be a successful operation, services will need to be funded, so that pharmacy could have those sort of funding coming in order to be able to fund the hub and spoke service. And if the services are not funded appropriately, then it's going to be very challenging. And that's something that obviously we are liaising with PSNC very closely to make sure that the cost of services are accurate based on actually what the costs that happen in community pharmacy. So as I said, robotics require constantly a management and investment. And so it's not an easy task. And for that, there needs to be funding in the system to manage that. And one of the biggest challenges that we are facing around hub and spoke, that we need to make sure that, again, coming back to that topic of having the level playing field that we highlight, is that there needs to be similar regulations around hub and spoke in pharmacy, and those who supply directly to patients via various different means, right? For example, post or delivering from hub to patient directly. So at the moment, the level playing field is not there, and we need to make sure that regulation is fair, both to hub and spoke operation through pharmacy and mail order pharmacies. And that's something that AIM has been very much championing over the past few months. Can I have the next slide, please? So I thought I would summarize AIM's position on hub and spoke. In relation to PACs, for example, we are talking about split PACs must end for safety and efficiency reasons. Split PACs, we've had a number of debates around that, and split PACs definitely have no place when you are talking about hub and spoke operations. Prescribing, again, from AIM's perspective, medicines must only be prescribed as 28-day multiples. Manufacturing, medicines must only be manufactured in 28 days pack, and bulk tubs and tablets should be made more widely available. And we have been writing to manufacturers, liaising with manufacturers and seeking their thoughts about it, how it could be facilitated. We've also been having conversations with wholesalers on this front, again, seeking their thoughts and opinions around that. In terms of like remuneration, we, from AIM's perspective, remuneration must always be paid as dispensed. And again, a lot of conversations have happened around that, and we've liaised with PSNC on that front as well. I talked about mail order direct to patient, making sure that there are level playing fields around that. I refer to regulations, for example, a delivery driver in community pharmacy who delivers medicines from pharmacy to patient, it has relevant training, and pharmacy is obviously regulated, and the training is accredited. We also have various different things in regards to GPHC and how GPHC's role fits within this from a regulation perspective. The same with MHRA regarding, for example, cold chain and managing that, and how we manage controlled drugs, for example, controlled drug deliveries. So a lot of the details around how there needs to be a proper level playing field has been taking place, and we have brought that to the attention of the department. Supervision, some of you may know that currently there are discussions around supervision across the sector, and these discussions are now taking place with various different organizations involved, including the Pharmaceutical Society and other employer and employee bodies, and also the Department of Health. So looking at various different elements around supervision and how that fits with community pharmacy practice that we currently see. And patient consent, again, another area that from our perspective we have been looking at, and consent for a patient to be dispensed by hub and spoke to be informed consent. So these are the sort of things that we have been discussing and forming position on, and we're making sure that these positions are communicated with the department. Next slide, please. So when it comes to PMR, so I have to have a slide about PMR suppliers. And so basically, we have been writing to PMR suppliers, including EMIS, discussing hub and spoke from a PMR perspective. And we know that our members are currently running hub and spoke system for both original packs and MDS patients. And the highest volume member is producing around 52,000 items a month. And one of the common problems using up considerable staff time at this point of time and undermining the whole smooth operation and effective production in hub and spoke is the nomination process, and nomination being removed and transferred to other contractors without a proper consent. And these are the sort of things that we have been discussing with the PMR providers to see how this journey can be improved and for them to look into that. So again, a conversation that we are having with the PMR providers. Next slide, please. So this is my last slide, and I know that I'm 1 minute away from my time coming to an end. So what's next? We know that our members and many in the independent sector are embracing technology and are innovating. Particularly during the pandemic, we have identified various different ways of working differently. From AIM's perspective, we work with various different supplier partners, and we have forums where our members can virtually meet and face-to-face, hopefully soon in autumn, and discuss in terms of like what they're doing in their businesses and in their practice and how they can learn from each other. And through that, we have, through these discussions forums, a lot of things have happened in that people have been looking at, you know, what works and what doesn't work, and what to develop and what to look at from a pharmacy perspective. So we know that over the coming months, we will increasingly be innovating, and technology providers, obviously, we want you to support us and provide us with you know, various different enablers, and also making sure that systems, for example, open APIs are allowed, and we can tap into that. And I'm very pleased that you know, I've had the opportunity to discuss with EMIS, and I know that you want to do the best for community pharmacy. So we shall be discussing further to make sure that you know, our members and our stakeholders can feed back to you and seek the best outcome for community pharmacy. So thank you again for this opportunity.
Brilliant. Thank you, Leyla, for that, which moves nicely onto where we're taking Proscript Connect in the next couple of years and our vision. So I'm just going to hold your attention for a little bit longer. I've got the last slot, so thank you for your patience so far. So if we first look, Leyla's already talked about the landscape of community pharmacy. I'm just going to touch base on the landscape a bit more and the changes that we're currently seeing. So we're well aware that pharmacy is changing. In fact, some change has been accelerated due to the pandemic. For example, when other healthcare providers closed their doors, pharmacy was the place that kept their doors open. And as such, a lot of patients now turn to their pharmacy as the first point of call for minor illnesses. And this is only set to expand as CPCS evolves. We've also seen changes to funding and remuneration models, and as a profession we can see that it's moving from a dispensing to a service-based model, and this is despite the number of prescriptions going up, but it's a known fact that the remuneration for prescription volumes is set to decrease, and pharmacists will need to be paid now on delivering services. Leyla's touched on hub and spoke and the opportunity and challenges that this brings. And it's a key change to the way pharmacy will operate going forward. As a PMR provider, we have and we will continue to attend Department of Health stakeholder engagement sessions, provide our input, and also raise our concerns to proposed changes and ways of working. We also know that pharmacists will be involved in the prevention of diseases and the prevention and detection of illness and the management of long-term conditions. However, we also know that pharmacists often work in silo, so now more than ever, pharmacists need better access to healthcare records in order to deliver safe and effective services long term. I've already mentioned that the NHS in the NHS 5-year plan are looking for pharmacists to be the first point of call for minor illnesses and disease, and with CPCS evolving to A&E and the rollout of GP referral, this is set to expand. NHS Digital are also jumping on the bandwagon and have introduced changes to EPS, so their EPS Next Generation, which is being built on FHIR. And this is something of which we really welcome, as it brings so many opportunities to join up the healthcare sector. This, however, is just touching the surface of the pharmacy landscape and all the changes that exist. So what does this mean? Well, we understand the world of pharmacy is changing here at EMIS, and it's evolving at a fast pace, and that you need our customers' technological solutions to support you. So this is our vision. Our vision is to be the leading pharmacy provider of innovative and integrated healthcare technology through listening and talking to our customers and understanding their challenges, enabling them to deliver faster, safer and better healthcare. So what do we exactly mean by listening and talking to our customers, and why is this important? Well, in Steve Jobs' words, the broader one's understanding of the human experience, the better the design we will have. This is why, as Suzy's outlined, we've put money into and have appointed a product experience and design team to look into the needs of our customer base. The aims of this project experience and design team are to identify the needs and wants and desires of our customers. We would like to understand what works well for you, what requires improvement, what features and technology are required for the future of pharmacy, what are your ways of working, as we understand that one size does not fit all, and what do you need to manage your workload. Phase 1 of this project will be a deep dive into the ways of working in pharmacy with one-to-one discussions, and phase 2 will involve observational contextual sessions inside the pharmacy. We will continue to engage and validate throughout the design and development process and map out a journey before looking at a high-level redesign of Proscript Connect. However, this is the lengthy process, and alongside this we will continue to develop and enhance our existing product, and here are some of the areas we look to focus on. So key areas of focus for Proscript Connect in the coming years: modernisation of Proscript Connect, including the wider use of browser-based applications, cloud technology, APIs, and intuitive and flexible user interfaces. As Leyla just mentioned, APIs is the way forward to allow for seamless integration with other products and generic APIs for partner apps. We also understand that as a business, we need to deploy new functionality enhancements at a faster pace, and therefore we're looking to move Proscript Connect to a browser-based application. We also understand that standardising data conversion sets is a must. For example, the implementation of dose syntax in line with the PRSB standards. This will assist with medicines management and seamless data sharing, for example. The government initiatives are a huge element as well. For example, integrated care systems and how pharmacists can be an integral part of them from a technological point of view. We also have the implementation of EPS Next Generation, and this brings a raft of benefits. For example, improved cancelling of prescriptions. So what does the roadmap for Proscript Connect look like in the next year? Well, at the end of this year, Q3 and Q4 2021, we have some enhancements to the Proscript Connect prescription tracking system module. As highlighted by Suzy, this will help to improve and is based on feedback from our Smart Pharmacy module that we'd like to bring out. Further enhancements to Pharmacy First Scotland, as this service evolves and more conditions are added. We're also looking to improve and enhance our Clinical Services Hub PGD offering. And as already alluded, to start to look into the next generation Proscript Connect design. EPOS till phase 1 and 2. We are looking to release that in Q3, Q4, and going into early next year, phase 3. We also be releasing the Discharge Medicine Service module and serious shortage protocol endorsements. Going into Q1, Q2 of 2022, we're looking at implementing a clinical accuracy checker, and we know that a lot of our customers have actually been waiting for this, as it helps to improve patient safety and frees up pharmacists' time to enable them to deliver more services. As Suzy mentioned, we acquired Pharma Outcomes Pinnacle last year, and we have already begun to integrate some of their modules into Proscript Connect, and we'll look to integrate this further next year. Hub and spoke, again, is a huge area which we're focusing on, and understand that one size does not fit all, and therefore we will be focusing on solutions for both independents and multiples. We also have EMIS X, integrating and providing live data feeds and dashboards, and implementing, as I mentioned, NHS Digital's changes to the EPS. So finally, moving on, what is our commitment to you? Well, we commit that we have easy to use technology at the point at which it's needed to provide effective reporting, stock and data management for operational efficiencies, optimise workflows around dispensing and meds management, and finally, better integrated healthcare services for effective delivery of additional services, offering you and our customers new revenue streams. I hope that's provided a quick snapshot to you, and it's over to questions.
Thank you, Sima. Thank you, Leyla. Brilliant. Now, we don't have any in the window. Oh, hang on. And now there's a question coming from Raj saying, it popped up and I missed it. Where is it? Is it gone into normal conversation? Is there a possibility, is it possible to integrate travel clinic consultations into the PMR? I think I'm going to pass that one to Sima.
Thanks, Suzy. Hi, Raj. Yes, that is something we're looking into. We have had a couple of our customers actually reach out to us, and although we offer the travel vaccinations via our Clinical Services Hub PGD offering, the actual travel clinic consultation is one element that we're lacking at the moment. So it is something that we're looking into potentially integrate into Proscript Connect via Clinical Services Hub, or some sort of a travel algorithm portal as well, to decide which vaccination or medication is needed for which country, similar to NATNAC. I hope that answers your question, Raj.
Thanks, Sima. I'm just listening between these two chats to make sure this hasn't come back into that window. Oh, okay, excellent. So I think I'm going to publish this one. Okay, so this is from Nitesh in Neva Pharmacy in Leicester, and Sima, again, this one's coming to you. Are there any plans to make Proscript Connect web-based?
So yes, based on our feedback to date, and also the way technology is moving forward. We are looking to move it towards a cloud-based solution. However, it's not as easy as just lifting and shifting the whole application. So we're likely to do it in a modular approach, but that is the direction of travel. As I said, we need a way to get our updates out quicker to our customers, to deliver our solutions at a quicker rate, and by moving it to the cloud, that's one of the ways that we can achieve that. So that is the direction of travel, yes, Nitesh.
Thanks, Sima. Okay, let's go back into the other conversation. I think someone helpfully has posted, I think that's a comment back to Raj, and the PGG services on patient access can they, oh, hang on, no, maybe not. Sima, I don't know if you can see that.
Yeah, just splitting between the two, sorry. Yeah. Hi, Raj. So yeah, the PGD services and patient access, that can that be integrated into the PMR? So are we discussing the patient access professionals appointments here, Raj? Because at the moment we only integrate our own PGDs. Are you talking about third-party PGD providers here, or the appointments part?
Got to do fast typing now.
Yeah. Perhaps we can pick up separately, Raj. But if it's regards to integrating the appointments into Proscript Connect, that is an area we're looking into, because we know there's a bit of disjoint from you. Can Sarah, can we have take Raj off mute?
Yes, 1 second.
That might have worked. Raj, want to say something?
I think, yeah, there we go. Perfect.
There we go. Hiya.
Oh.
No, we can't hear you.
Yeah, we can't hear you. I'm so sorry. There's probably a microphone issue. It doesn't look like you're on mute, Raj. It's just a speaker's problem, I think. Yes. Thank
Perfect.
you.
I'll give you a call tomorrow, Raj. That's okay.
Good old-fashioned technology. Phone works every time. Right, let me just have a quick look back. So I think we are all, oh no, okay, so hang on. Sima, you're working hard tonight, right? So these are both coming to you, I think. So it's from Ola. Is there a way that Proscript Connect can differentiate between RMS scripts and other scripts?
Yeah, so Ola, if you want to get in touch with the service desk, we can run through that one with you. If I'm just moving on to George's, will cloud-based take the payment model away from? I think that might be one for you for the cloud-based. I'm going to pass back to you, Suzy, when it comes to commercials, I'm afraid. George's.
No, that's absolutely fine. Thank you so much for the feedback, George. Absolutely. Just like we're looking at ways to be more flexible with the actual product, we're also looking at more flexible ways for you to pay for the product, and for it to more closely be aligned with usage and the value that you're getting for it. So absolutely, we're looking at new commercial models. Go back into this one. I think we're done. I think that's all the questions covered. So yeah, I think we're good. Okay, all right. Well, thank you for bearing with us. Slight technical challenges, but anyway, I hope it was helpful and you enjoyed it and it was useful. And any other questions, please do. I'm sure you probably know Sima's email address or mine, so please do feel free to drop questions through to us direct as well by email. So the session on the user group, I think, is starting at 8:30. I hope some of you will join and hear about that. And because we're very excited about what that user group's going to achieve with us. So thank you so much for joining us, and have a lovely evening. Thank you. Bye.
Bye.